guys, welcome back to Medical Coding with Blue. Today's episode is all about which medical coding certification should you start with, the CCA, the CCSP, or the CPC. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so last week on Thursday, I did an episode where I'm talking about the different credentials and what they mean and that kind of thing. And inpatient versus outpatient versus a combination of the two. This confused a couple of people. So I said, okay, let me go ahead and explain this in a separate video all by itself, so that way I'm even more clear. Guys, when you are brand new, when you're a brand new medical coding student and you're trying to decide which medical coding certification to sit for, you have a choice because employers are looking for credential holders from either one of these two associations. You only need to be certified with one. I will continue to say that. You only need one. Because one of the ladies that was so confused, she said, I'm so confused. And that she read that you can be certified through, okay, guys, you just need one. The American Health Information Management Association and the American Academy of Professional Coders. These are who employers are looking for. Now, when you are brand new, if you want to code on the inpatient side or the outpatient side, you have the choice of the entry-level medical coding certification called the CCA. That is a Certified Coding Associate, and that is with the American Health Information Management Association. I had the CCA for 13 years. I stubbornly held on to it because it is a fantastic credential that does not get enough credit. And there's a lot of people that talk like they know and they don't know. The CCA is like a precursor to the CCS. No, you will not get more money if you are a brand new student and you get the CCS right out of the gate. You're not going to get more money. These credentials are not based on if you have this credential, you'll make more money. It's not that way. They are distinct in what they are saying that you are competent in, okay? So if you want the choice of being able to code on inpatient side or the outpatient side, then you say, okay, well, Blue, I don't think I'm ready for the CCS because the CCS is the mastery. Not to say that there's not some people who finish a program and then they're able to sit for the CCS and they pass it, but that's not the majority, okay? The majority of people who try to do that right out of school because they don't pay attention to the CCA, they want to go right for the CCS. It shows because they fail. And if you look at the pass-fail rates of the CCS, you'll see that it is very difficult to be a first-time test taker and pass that exam. So the latest one that I had seen was the pass rate for the first-time test takers was in its 40s for the CCS. So that's something that you got to think about. You want to set yourself up for success, and especially when this is a brand new field to you and you don't know about all the ins and outs, but you say, okay, well, Blue, I learned ICD-10-CM, I learned CPT, I learned HCPCS, and I learned ICD-10 PCS. I want to take the CCS in the future, but I think I'm going to go ahead and start with the CCA. That's great. Because the CCA says you have the entry-level competence to code in inpatient or the outpatient side. And yes, you can get a job. Because how do I know that? I had 4 jobs. And I progressively made more through each job that I had. And not only that, I was able to change hearts and minds because people didn't know what a CCA was capable of. The CCA, the Certified Coding Associate, has the most domains of any medical coding certification exam, and that includes the CCS. It is a 2-hour exam, and it is a wonderful credential to have. It is a wonderful way to get yourself into either coding for inpatient or outpatient. Now, so hopefully that is clear in there. If you want to do that, you do have the choice between the CCA or the CCS. But if you're asking me what my opinion is, start with the CCA. Have that for the 2 years and then sit for the CCS at the end of those 2 years. That makes sense because it will give you time to be in the field and really understand, work on your speed, because that's what these exams are about, is speed. It is 2 minutes per question because a CCS is a 4-hour exam. And then there's no set number, because everybody has a different amount, okay? It's between 115 and 140 questions, I believe. So, that's something that you have to know when you're preparing for the CCS. But if you want to sit for that CCA, it's a 2-hour exam, but it still packs a punch, okay? And there's a range on there. I forget, I can't think of it off the top of my head, but that's not important. The important part is if you want to sit for the CCA, by all means, go ahead, okay? It's a great credential. You can apply anywhere with it. And when you are out there applying, you'll be able to show those employers what a CCA can do as well, okay? And if you want to sit for the CCS at the end of those 2 years, that's fine too, okay? So that's out of the way. Now, let's say that you learned in your program ICD-10-CM, CPT, and ICD-10, HCPCS. HCPCS. So you learned those 3, right? And let's just say you didn't learn anything on the inpatient side, and you didn't learn anything about PCS. And so you say, okay, well, I learned these things. I hear everybody saying to sit for the CPC, but the CPC has an apprentice status on it for the first 2 years, until you get your job experience in 2 years, and then you can get it taken off, or you can go through Practicode, and there's all these other steps that you can take to remove it faster, even though it doesn't make sense to remove the apprentice status faster when you still have no experience. So, well, Blue, it's a lot of money because it's $205 every single year that you hold your certification. It's 36 continuing education units. It just seems to be more expensive. I want to go with a HEMA, but I don't want to sit for that inpatient side. Good news, they have one certification that is only outpatient coding, and that is the CCSP. You do not have to have experience in order to sit for the CCSP. None of the 4 main medical coding certifications do you need to have experience. It's recommended. Recommended does not mean required, but it's recommended because they want to set you up for success. Now, if you want to just sit for the CCSP, again, that's ICD-10-CM, CPT, and HCPCS. If you sit through that, okay, great. A HEMA will not charge you a membership fee every single year. They will not require that, but they will charge you to report your continuing education units that you have to have in order to maintain your certification. It is 20 for one certification versus the 36 that you have to have with AAPC for that CPC. So it's really a choice that you have. And a lot of people don't think they have that choice. And sometimes people say, well, is that through a HEMA or is that through AAPC? I'm going to leave the link for both of those associations in the description box below. Or you can simply Google that certification and you'll see that it'll be able to come up and then it'll tell you all about it. Please do that, guys. Because when you're asking me simple questions like, is this through AAPC or is this through a HEMA? That's telling me that you don't do your research. And if you're somebody who doesn't do their research, this may not be the field for you because medical coders are required to do their research. Not everything is about looking up a code and then applying a code without really understanding why you're applying that code. Sometimes it's not going to be very clear. And doctors and other providers, medical providers, do not have to use the language that is in these books, the ICD-10-CM, the CPT, or the HCPCS, or ICD-10-PCS book. They do not have to use that specific language in order to be able to document. And we have to be able to figure it out because it may not even be in that book. But if we can translate what they're saying into, okay, this would be the code to fit that one. We have to be able to do that. So again, guys, if you're asking me simple questions like, oh, is a CCA through a HEMA? I'm not going to respond because, again, that's a very simple going to Google or going to a HEMA, ahima.org, or you can go to aapc.com if you are wondering about the CPC. I recommend, guys, and please hear me when I say this because several people didn't hear me, but several people did from that last video. Start with one certification. That's all you need. For the first 2 years, that is all you need because a lot of people fall into that trap of, oh, well, you need this credential and that credential. You need to be certified through both associations. There's a school out there. I won't mention which school it is, but there is a school out there that pushes, oh, you need to get this credential and that credential so you can be certified through both associations. No, ma'am, no, sir. You don't need to. Do you know why? Because when you look in those job listings, it tells you that the candidate only needs to have one certification. It has never said candidate must have multiple credentials in order to get this job. Never once have I seen that. And I look at the job listings, guys, because I do my research. It's my channel about medical coding and the medical coding field. So yeah, you betcha, I am going to look through those job listings, and I am going to look and see what these employers are looking for. Again, they are looking for candidates to have one certification. And I say to wait 2 years so that way you can build your knowledge. You're not going to be like these people who get sucked in and have a whole conga line of credentials after their name and have no idea what to do with it. This one lady, she had her CPCA, and then she goes, oh, well, I'm sitting for the CPMA next. And I go, why would you do that? Well, my teacher said. Your teacher said, well, what are you going to do with it? Well, I don't really know, but I just think it's important that I get it. So if you don't know what it's for or the purpose of it, why are you getting it? Because that's more money that's coming out of your pocket. And for everybody who's so overly concerned about the money, y'all sure are ready to spend it when it comes to, racking up these credentials because you think it makes you look more competitive. You think it makes you look more knowledgeable. If I'm a hiring manager and I see somebody with who's brand new, no experience, with a bunch of credentials after their name, I know this is somebody who's concerned with the optics and how things look rather than, and as a person who takes tests, and because essentially that's what it is somebody who takes a bunch of tests. Back it up with experience, back it up with know-how. That's what you do. Not that you take a test and you can say, oh yeah, I can do diagnosis coding. Well, guess what? That CPC, the CCS, the CCA, or the CCSP, they all test on diagnosis coding. Why would you take a separate test that says you can diagnosis code? Oh, well, I want to do one for billing. Again, all of these 4 main medical coding certifications all test us on reimbursement. Why would you sit for a credential that says you know how to bill? And when you look at the job listings, is anyone asking specifically for that? Not many. I rarely see it, rarely. And it's maybe once in a blue moon that I'll see somebody ask for the CPP, but it's usually like somebody that's not in the industry. It's usually like an attorney's office that will ask for that. And only because they don't really understand what we do as medical coders or what these certifications are about. At least that's my opinion anyway, and that's my thoughts on the matter. But please hear me when I say, all you need to start is just one. You can pick any one of these 3. Because if you're asking me, do I recommend for brand new medical coders to sit for the CCS right out of the gate? If I'm being honest with a lot of you, no. Because I know a lot of you don't study enough to be able to sit and pass for that certification, that CCS. I know a lot of you don't. Now, there's some of you that go to great lengths to really understand. And those are the people I would be more confident to say. But if you're asking me in general, I would recommend one of the 3. The CCA, inpatient and outpatient, that you can sit for, okay? Inpatient and outpatient, you can apply for those jobs with that CCA. The CCSP, the Certified Coding Specialist Physician Base, this is with a HEMA, and it says that you know how to code in the outpatient setting. Or the CPC, that is with AAPC, and it says that you can code in the outpatient setting as well, okay? But I'm going to recommend medical coding credentials that I know that are going to be beneficial for new medical coders to get hired with. Any one of these 3, and you just need one, okay? Now, let's say, for instance, you decide that you want to go ahead and sit for the CCSP and you pass it. And you think, okay, this is great. And then you say, in 2 years, you say, okay, well, Blue, I think I want to go for the inpatient, outpatient. Should I take the CCA? No, you can't, because that would be going backwards. Because the way that AHEMA has it is that there's the CCA, that's where you start. And then there's a CCSP, that's the mastery of the outpatient setting. And then you have the CCS, that's a mastery of the inpatient and the outpatient setting. If you start off with the CCSP, you cannot go back and take the CCA, okay? Because that credential, the CCSP, already supersedes the CCA, which means that if you had started with a CCA, that once you get the CCSP, that CCA you can no longer carry. So when I see people who try to carry CCA, CCSP, or CCA, CCS, I know that's incorrect, because you are not supposed to carry the CCA when you carry a CCSP or the CCS, okay? That's not the way that it is. And according to the website, you'll be able to see that as well. So the day that I got my CCSP was the day that I removed CCA from my name, and I put the CCSP there, because that CCSP supersedes the CCA. So again, you cannot carry both. And that's just something that you have to know. That's the way a HEMA is. I have brought it up before that I think it's important, but they say no, that it has to be that way. So I said, okay, you know. So I will always advocate for people to get the CCA. And that was another question that the lady that was so confused asked me. So do you still recommend the CCA? I don't know how much more clearer I can be other than absolutely I recommend the CCA for brand new people, but only if you've gotten the ICD-10 PCS training. For some medical coding programs, they don't include that, or it is included, but it's way at the end of their program, and it's maybe a month or 2 months, you know? And so that is definitely not enough time. That is definitely not enough time to learn ICD-10 PCS. To be in a good length program, your program needs to be at least 9 months, 12 months, or 18 months. And I have said that repeatedly. And people still get into these 6-month or 4-month programs. God forbid they get into 2-month programs, but they still do it anyway. You know, again, my purpose here is to help you all to understand that, yes, this is a confusing industry. There's a lot of things to it. There's a lot of acronyms. There's a lot of credentials and things like that. But when you pay attention, right, to these videos and the things that I have said about these videos and the things that I've talked about and discussed and things like that, it's not that hard, guys. It's not that hard, especially when, again, you're doing your own research, coupling that with the things that I'm talking about. Then you'll understand, okay? But these simple questions, they've really got to stop, because simple questions can be answered simply with a Google search. And that's the way that I am, because I come from that time where we did our research. We didn't have Google and all this other stuff when I was in school. Yes, the internet was coming out, and yes, there was exposure to it and things like that, but it's not like it is now, where everything is about the internet and everything is about, you know, oh, it's just a simple Google search. You know, if I wanted to do a paper when I was in school, I had to go to the Encyclopedia Britannica and look it up the old-fashioned way. And there's nothing wrong with that. And I'm very proud of it. I can also write in cursive writing as well. I can read it too, you know. And unfortunately, that's a big part of where this next generation is losing a lot of that, because a lot of them say, I can't even read cursive writing. There's no reason for that when there's so many videos out there that can help you to learn. And just because you didn't learn it in the school doesn't mean that you can't teach yourself, okay? So that's just gonna be my message for today before I get on my soapbox about education. And I know that there's a lot of teachers out there that are doing a fantastic job trying to help these kids. And it's very difficult when they have to compete with things like the internet and things like, oh, you know, we have this philosophy and things like that, when the whole time, you know, when you're trying to teach somebody and you're doing it in methods that people don't like. Like, for example, when I tell people, oh, you would not believe how much people used to hem and haw at me for telling them to write flashcards out. I don't want to do that. Then why are you asking me if you already know what you want to do? Why are you asking me? Because if you already have it figured out, then obviously go ahead and do it your way. But if you're asking me my opinion, and if you're coming to my channel and looking at my advice is always going to be the old-fashioned way, because the slow way is the fast way. I'm not somebody who has to stop and wonder what something means, because I've already done my flashcards, I've already listened to videos, I've already fit in the time to study for those little things that confuse me. I stop and I look at things when I don't understand something, even to this day. And I've been in this field for 15 years. I still stop and I still look. And I'll still stop what I'm doing completely and try to figure it out. If there's a word that I can't remember, I can't recall, then I'll look it up as well. But again, that's part of my ingrained training, that I always did that all through school and even as an adult, you know. But it's not something that, you know, you can't do just because, you know, you weren't taught that way. You know, say that five times fast. It's not something that you can't pick up, right? So that's just what I'm saying, guys. It's a lot of studying and a lot of reading. And you would be surprised how many times people tell me, I didn't know it was going to be this much reading. It's medical coding. Medical coding. We're reading documentation all day long. You know, I'm just saying. But yes, you have those three to pick from. Okay? Just pick from those three. If you learned inpatient and outpatient, you're sitting for that CCA. You want to do that, you go right ahead. But if you only learned outpatient coding, ICD-10-CM, CPT, and HCPCS, then go for either the CCSP or the CPC. Either one, you'll be good to go. But if you sit for that CCSP, you will not have to mess around with that apprentice status, guys. You won't. Okay? Because apprentice only applies in medical coding. Apprentice applies to AAPC credentials only, their flagship credential, the CPC. That's the only one that carries that, okay? So, something that you gotta know. But, keep that in mind. And even if you learned ICD-10 PCS in school, you learned about inpatient coding, and you say, well, Blue, I just don't feel strong enough to take that CCA exam. Can I just sit for the outpatient? Absolutely. You can choose from the CCSP or the CPC. Either one of those, and you'll be good to go, okay? So pick one of the three, and then study, and then sit for your certification exam, and then you pass it, and you get out there and you get yourself a job. And then you wait 2 years, and then you decide to move on. If you want to go on to the CCS, that is totally fine. If you want to go on and add other credentials after that, after those 2 years, that's great, because it's given you time to be in the industry so that you know and you understand, and that you're not doubling up on credentials unnecessarily. Because remember, at the end of the day, guys, it's a business out there. Health information is a business. Oh, believe it. It is a business, but it is also your business to be the savvy medical coder and make sure that you're not just purchasing things willy-nilly. I'm just saying. With that said, I'm going to go ahead and wrap this one up. Best of luck to you out there. Again, I will leave the links for those two organizations in the description box below. If you have any specific questions, you take those questions to the associations. All right? So I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. I will see y'all next time. Bye.